Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have with me Dr. David Dingley, who's an MD, PhD, professor of medicine at the reputed Mayo Clinic in Rochester, Minnesota, which is one of the preeminent institutions in the world for plasma cell dyscrasias, myeloma, amyloid, and then POEM syndrome, which we're going to talk about today, which is a more rare entity. Welcome, David.
Thank you, Dr. Vich, for inviting me.
Thank you for being here. So, for our audience, can you tell them what the acronym POEM syndrome really means?
Yes, so as you mentioned, POEMS is an acronym, and it relates to the presence of polyneuropathy, organomegaly, endocrinopathy, a monoclonal plasma cell disorder, and skin changes. And we can probably expand a little bit on what these are. So polyneuropathy, this means damage and symptoms related to nerves. And these are peripheral nerves. So typically, the problems start with a sensation of numbness or stabbing pain in the feet that can progress to involve the arms, and if untreated, will move upward, move more proximally in the body. Initially, it's a sensory problem with these symptoms that I mentioned, and sometimes people will have a sensation of coldness in their feet, even though they have a good circulation. In time, if undiagnosed and untreated, it will start involving muscles, and it will start involving muscles of the feet and legs and move upwards. And the pattern is actually quite important. If it's a hereditary neuropathy or a drug-induced neuropathy or say B12 deficiency, symptoms often would start in the feet and progression tends to be quite slow, and oftentimes muscle weakness does not occur. In this condition, the tempo of progression tends to be a little bit faster, and muscle weakness tends to follow soon after the onset of sensory symptoms. So it will be unusual to have a POEM syndrome who has had sensory symptoms for 5 years, and then we diagnose it. Typically, things occur a little bit at a faster clip, and it is important to diagnose it because of this issue that symptoms can get worse quite rapidly.